This is Dr. Vijay Swarup. I'm going to discuss today the latest data available on the PROTECT AF trial, which was assessing the WATCHMAN left atrial appendage occlusion technology. I was randomized to compare that with the control arm compromising treatment with Coumadin. So first of all, WATCHMAN left atrial appendage closure technology still remains under review by the FDA and is considered investigation. So PROTECT AF clinical trial, as we know, was a prospective randomized study of the WATCHMAN left atrial appendage device, and it compared that to long-term Coumadin. There was a 2-to-1 allocation ratio of device to control. There were 800 patients enrolled from February 2005 to June of 2008. There were 93 roll-ins and 707 were randomized. There were 59 enrolling centers, and they were followed up with TE at 45 days, 6 months, and 1 year. Clinical follow-up was biannual up to 5 years, and INR monitoring every 2 weeks for 6 months and monthly thereafter. So there are different data sets. The current data set available for review is the 1350 patient year data. As you see, the average follow-up in years was 1.9 years for patients. And so the mean follow-up in 1350 patient year cohort was 23 months. So if you look at the enrollment summary, there were randomized patients with 707, and of them, there was the control arm was the Coumadin arm, which had 244 patients. Implant was not attempted in 15 patients. Total implant patients were 449, and Coumadin was started in 241, and 3 people did not start Coumadin. So the baseline demographics, the characteristics in terms of age, gender, and race were comparable in the two groups. The baseline risk factors were also comparable. The majority of the patients, however, were CHAD score 1 and 2. Approximately 20% of the patients were CHAD score 3 and above. If you look, most of them had paroxysmal atrial fibrillation. Persistent fibrillation or permanent fibrillation was in the other half of the group, which is almost 30%. The ejection fractions were again comparable in the two groups. 76% of the randomized patients discontinued Coumadin or warfarin at 45 days. 87% of the implanted patients discontinued warfarin at 45 days. At 6 months, the number was higher to 92%. At 12 months, 93%, and thereafter it stayed around 93 to 94%. The reason for continuation or reinitiation of Coumadin remained between physician discretion for other risk factors and observed flow around the left atrial, into the left atrial appendage. So the primary efficacy endpoint for the WATCHMAN device was all stroke, ischemic, or hemorrhagic. There was cardiovascular and unexplained death and systemic thromboembolism. So the safety events are also counted in the efficacy endpoints. The efficacy endpoints were stroke, systemic embolization, and cardiovascular events. Stroke, both procedure-related and hemorrhagic, was also considered in the safety events. So we look at the two cohorts. 1350 patient years, the event rate the efficacy event rate was less, 31% lower relative risk in the WATCHMAN group, and the non-inferiority criteria was met. And again, when we look at the efficacy, you see the WATCHMAN arm, which is in the solid line, and the dotted line has the control arm. It appeared seemed better efficacy with the WATCHMAN group as compared to the control arm. So the primary efficacy endpoint were seen predominantly on the day of the procedure, which was procedure-related complications, and that was the major difference. And even if you exclude the day of the procedure, the peri-procedure event rates in the WATCHMAN group was 31% less than the control group. And if you look at the strokes in the two arms, in the intent to treat analysis, there was 22% lower relative risk of stroke in the WATCHMAN group. When we do the sub-analysis, and subgroup analysis was performed using the age, risk factors, and the AF pattern, the results were favorable to the device arm across all patient subgroups. Now we look at the safety results in this study. Now when we look at the safety results, as with any device versus drug comparison, there is a higher upfront acute risk of complications associated with the procedure. And there is a numerically lower but continual risk with drug use. So primary efficacy endpoints in this study focused on peri-procedural events and long-term bleeding or device embolization events. These events included device embolization events which required retrieval, bleeding events, cranial bleeding events from any source, GI bleeding, and any bleeding related to device or procedure that necessitated an operation or more than 2 units of RBC infusion. And when we look at the intent to treat primary safety results, there is a slight difference, and the relative risk was 1.6 higher in the WATCHMAN arm. So, like we see here, that there's initial. In the WATCHMAN arm, there's the initial complication rate, and as we continue to follow, the higher risks in the control arm. In the timing of events, the upfront risk at the day of the procedure was significantly higher in the WATCHMAN, as expected in the WATCHMAN arm. The highest rate of safety events occurred on the day of the procedure. After the peri-procedural period, event rates in the WATCHMAN group were considerably lower than the control group. And again, this shows the events during the procedure implant. The pericardial effusion rates was 4.5% in the implanted group, ischemic stroke 1.1%, 0.2% risk of device embolization, and major bleeding was again 1.1%. Total event rates were 34, which were 7.3% of the implanted device. Events after 7 days were no different in the two groups, WATCHMAN and the control. If you look at the all-cause mortality, there was a 30% lower relative risk in the WATCHMAN group when we look at the current data set. PROTECT-AF also had this evolving experience, so the improvements were made throughout the PROTECT-AF trial. There were better training, learning curve, and technical improvements. So when you look at the learning curve, the procedure times as compared to the first, early, and late patients came down considerably. There was the safety events also were much lower as the trial progressed. The implant successes went up, and the serious pericardial effusion within 7 days of implant came down rather dramatically. When we divide the study into 3 tertiles, and the last one is the CAP registry, or the Continued Access Program, we see that procedure times came down from 70 minutes to approximately an average of 50 minutes. Safety events have gone down dramatically from 9% to 2%. Implant success rates up to 94%, and serious pericardial effusions is down to approximately 2%. So in conclusion, PROTECT-AF trial evaluated WATCHMAN device and compared it to warfarin. It was the only study comparing device to drug for stroke prevention in atrial fibrillation. It was a prospective randomized controlled study of 800 patients, and 87% of the WATCHMAN patients successfully implanted were able to discontinue warfarin therapy. In the efficacy, there were 30% fewer efficacy events in the WATCHMAN group. In total strokes, there were 22 fewer strokes in the WATCHMAN group. And most of the events, so in conclusion, PROTECT-AF trial evaluated WATCHMAN device and compared it to warfarin therapy. It was the only study comparing a device to drug for stroke prevention of atrial fibrillation. It was a prospective randomized controlled study of 800 patients, and 87% of patients who were implanted successfully were able to discontinue warfarin therapy. And in terms of both safety and efficacy, the efficacy events were 30% fewer in the WATCHMAN group, and the stroke risk was 22% fewer in the WATCHMAN group. So it did compare favorably to the Coumadin arm, and it did meet the non-inferiority criteria. Thank you.